Good afternoon, good morning. Thank you everyone for joining today, and especially for the work you do supporting mothers and families. We are excited to be part of the Black Maternal Health Week and to contribute to the theme of rooted in justice and joy, which really speaks to the importance of building systems that support, uplift, and empower mothers throughout their difficult journey. I'm Rohit Mathur, co-founder of FieldWorker AI and AbilityHUB. Along with me, I have my colleagues Sunny Nair and Shravan Gharath with me as well. By way of context, our technology platforms are used by organizations and families to improve care coordination and care management, particularly in community-based and home-based care settings. Over the past few years, we've seen firsthand how gaps in communication and visibility can impact outcomes, especially in maternal care. Today, we are going to share some practical approaches to making care more connected for both providers and the families of the individual who's expecting. We know that many of you joining today are from organizations providing maternal and community-based services, and many of you are doulas and caregivers working directly with mothers every day. You all see firsthand where the system works and where it breaks down. One of the consistent challenges we hear across the board is fragmentation. Information is scattered, communication is inconsistent, and families often don't have clear visibility into what's happening in their own care journey. For providers, that means more administrative burden and less time with the people that you are caring about. For mothers and families, it can mean missed follow-ups, confusion, and feeling unsupported at critical moments in their journey. So what we want to focus on is a simple idea. What if care was more connected, visible, and collaborative for everyone involved? That's where our tools, FieldWorker and AbilityHUB, come in. Not as replacements for the human side of care, but as enablers of better coordination and stronger support systems. So in this session today, we'll do two things. First, briefly walk through how organizations, care provider organizations, case management organizations, doulas, can use FieldWorker to manage and coordinate care for pre- and postnatal women. Then we'll show how AbilityHUB, which is an app, extends that experience to mothers and their circle of care, everybody involved in their care, from family, from significant others, friends, giving them visibility, communication tools, and ongoing support. We'll keep it practical, grounded in real-world workflows, and we'll end with time for questions and any discussions that you might want to have. We would like to keep this session very interactive. So as we go through this, feel free to think about your own workflows today, where your information flow works, where it breaks down, and where families are left out of the loop, or information to you is also not available. That's really where these tools can make the biggest difference. So we'd like to keep this interactive. Feel free to just ask a question in the chat. Our information is also going to be shared in the chat. Feel free to drop us an email. We would love to hear your thoughts and your ideas as we go. I'm going to pass the baton to Sunny Nair, who's going to be sharing the software as it runs, the platform as it runs, and will walk us through both FieldWorker first and AbilityHUB next. So over to you, Sunny.
Yes, thank you, and good afternoon, everybody. As Rohit mentioned, this is Sunny here from FieldWorker, and I'm going to be walking you through the FieldWorker system. I'm going to go ahead and share my screen. So this right here is the FieldWorker home screen. What you're going to see today is a very generalized version of what's available. You know, every agency, just like yours, follows their own process, and we believe in configurations, right? We believe in setting up stuff according to your agency. So we have a generalized view of what's available. And then when you decide on moving forward, we meet you, try to understand the process, and make sure that you can get everything that you need from our system. This right here is our FieldWorker homepage. Typically on the home screen, as an employee or a doula, when you log in, you see your upcoming appointments. So if you have any upcoming appointments which are scheduled, your schedule for the next week, month will be displayed right here. You also then have timesheets, which is basically the time that you are spending with an expecting mother. So, whether it's a phone call, it's a home visit that you do, it's going to be present on the timesheets. And then finally, you have the recent notes. The recent notes are typically case notes that you collect, information that you shared during a call or a home visit can be documented into case notes. Now, the FieldWorker system is a to Z system, from creating a referral. So you can actually create a referral of your own on our system right here in this format. And the form can be configured based on your current form. Say if you have a current referral form or a format that you follow, we can create that on the FieldWorker system. And we provide you a link, right? A link or a QR code that can be put up on your own website. And you can now receive referrals through the FieldWorker system. So, any referrals that come in from our FieldWorker systems can be either accepted or denied by you as an administrator. And once it's accepted, it's created as a client on our system. So if you see right here, these are just some examples of clients on our system. You can store clients. We have different statuses. We have an active and inactive and a prospect status for clients. So the first time when the referral comes in, the client is a prospect. And as soon as the plan has been accepted or the client has been accepted to your agency, they then turn into an active client. We store a lot of demographic information, typically helpful while going through the journey is to make sure that you have all the demographic that you need. We store a bit of it. We can even add new fields. So if there is any field that we currently don't have, the date of pregnancy, that is something that a lot of agencies like yours like to collect. So we have a field for that. If there are any certain doctor appointments that you need to track, the 13-week, you can always store that in the client record as well. On the overview page, as a doula or an employee, what you also get access to is the recent notes. These are the 5 most recent notes that were added in for the client right here. The advantage of having the recent notes here is it gives you an overall idea of where you are with the client right here on the overview page. So as I go to different clients, you'll see the notes change and I get the notes for that client right here. Right? So that's with the client demographic with the home page. We then have the projects tab. Now, a project is typically a file for the client, right? Agencies like yours like to break down projects into multiple different projects, the first trimester, second trimester, third trimester. You will see that every project has a date under it. So as you go through, the rest of the information, the notes, the note collection, document collection, goals, all of this can now be broken down into different trimesters. So based on, if there is a certain goal that you need to achieve in the first trimester, you can store that on the system as well. And I will walk you through that. Every project has a date associated with it or a date period. Once the project is completed, it's going to move to the completed tab. We're an audit system. We want to be an audit system, so we never delete information. So, even if you're in the second trimester, you can always go back to the completed tab and view the information regarding the first trimester right there. So clients, or you never lose information, right? You never lose anything that has ever been added onto the system. And it's typically helpful in this line of business to always go back and refer to, any notes that you've added in previously. We then have the tasks option. Now, a task, you can either have a task that is pre-scheduled. So, if there are certain days that you're going to be with the client, or that you have to be with the client, you can store that, or you can create that on the system. That's with ongoing tasks. And then we have completed tasks. Now, a completed task is typically time spent with the client, between you as an employee and the client, right? With the expected mother. So Now, this can be either a home visit, a phone call that has been made, or any kind of information that you would like to store is present right here. So you'll see we have the schedule time on when the actual home visit was, what was the actual visit. So you have the actual time. You then have the phone call, when was the phone call made, how long did the phone call last. All of this information can be created or present on our FieldWorker system. You can also have forms associated. For example, this is just an example of a form that was created on our system, which is the prenatal encounter form. This is just one of the forms. You can create as many forms as you like, and it's a very simple drag and drop, right? We assist you as well. So we make sure that, when you start up or you decide on using FieldWorker, any form or any data that you would like to collect, we help you set up the agency and make sure that you're able to do your complete process through our system before we hand over the account to you. So these are just some of the forms, one of the forms that has been created right here. Once we have the tasks option, we then have the people. People is typically employees or doulas just like you, as well as customer contacts. So, doctor information, having this at hand in case of an emergency is always helpful. And hence, you as an employee can always refer back right here and view information for the client on, who the doctor is, who the, what is the contact or emergency contact for the client, as well as, any doctor information will be present right here. We then have the file section. File section is typically where you can store documents. So you can have, for example, you can take photos, any blood work that was collected for the parent, for the mother, any reports that you would like to store from previous doctor visits, just to keep sure, make sure that you have it in case it's needed. In this line of work, it's always good to have and need than to need and not have. So it's great to have these documents that you can store right here, and everything that you're seeing is HIPAA compliant, right? The whole FieldWorker system is HIPAA compliant. So any documents that you store, you have complete control on them right here. So for example, these are PDF documents. You can have an image, a PDF. You can even use our mobile app. So we have a FieldWorker mobile app where somebody can take a photo of a piece of paper and store it on the FieldWorker system. So it's going to be present right here in the files section. In order to upload, you can use the upload feature to drop a file. And this is where the different projects come up, right? So you can upload a document which is part of the first trimester, second, or the third, and you can segregate information in this format right here. We then have the case notes option. So every case note that is created on our client, on our system, has a timestamp with it. So it's going to show you who created the note, and if it's ever updated, it's going to also give you that information on who updated it and when. In order to add a case note, you can click the add a note option. This customer is already going to be selected. You can then select a certain project. If you need, you can even add a note title and then start typing in the note. We also have a voice to text right here. So if I click that and start talking into the laptop, it's going to start creating the note for me. And, as I go through, it's going to create the note. It doesn't do grammar at this point, but you can always go back and make changes as well if required. So when I click that and I stop it, you see that the text is right here. I can then hit create note, and that's going to create the note on the system for me. So everything that you're seeing is in real time. The minute you add a note, it's going to show up. It's going to be present right here. It's going to have the date and all of that information to the right of it. And in case there are any updates made, that information is also going to be updated.
And if I may add here as well, that let's say you're working as part of an organization and you have and we know you keep very busy, you're overwhelmed with work, and there are multiple people who are probably assisting or working with an expectant mother. You might have multiple caseworkers or one or two people. As long as that person, again, as Sunny mentioned, the HIPAA compliance, as long as two or three people are associated with that client, when you update a case note, that case note is updated for those individuals as well. So when they log into the system, everybody has the latest information available about the expectant mother in real time.
Yes, yes. It's a centralized location, right? It's a centralized location for all your information at one place, and it's going to be present on the FieldWorker system. We then have the goals section. So this is where the different goals can be stored, during your trimesters. If there are certain goals that you need to track for the expected mothers, so vitamins, medication, any different reports that you need to process before delivery can also be added in a goal, and you can also track the progress of these goals right here on the FieldWorker system. We then have the needs section. Now, the needs are typically for the expecting mothers, where you can have, either if they have any specific employee needs, any specific doula needs can be stored right here. Any health needs that are present or any support needs can also be stored on the FieldWorker system. And this information is available or readily available to you right here when you need it. We then have the form section. This is where you can store, or every instance of a form will be present. You can even create forms. For example, these are the two forms that I have on the system. Currently, you can have multiple forms, and you can even initiate a form right here from this screen. For example, if I say add a form, I can then go ahead and complete this information right here, member name, ID number, date of birth. I can collect this information, I can select, and I can then hit the submit option, which will basically create a copy of the form on the client record. We don't just create, we also give you a way of getting this information in a format that you would need. So if in case you want to view this form, you can hit the view option right here. For example, you can even download or print or download a copy of it. For example, when I say print, it's going to give me a PDF document with all of the information regarding the client right here. So when I click the print option, it's going to download a PDF, and it's going to have the company name, your company logo, the client who we did it for, and the employee who added the information in, and then the form, the way it is present on the system right here. So that's with the form section, where you can create multiple forms and you have access to it whenever required through our system. Now, with all of this demographic information, we have a lot of reporting. So in case as an administrator of the agency, or to get an overall idea of the number of hours that you are spending with a certain client, you can use a few of our reports. These are generalized reports that are present on the FieldWorker system. For example, the first one is an employee note report. It basically contains information for the client that you are working with, the project, the case name, and all of that information and the notes that were added in. Any of our reports can be filtered. So for example, if you want to see, let's say, for example, I say I want to see something that has Amanda in it. So I can filter this information only to display Amanda's records, so that I can then export and get a good history or a story of the client right here through our system.
Effectively, the idea is that we consolidate all your information, all the day-to-days that you're doing, all the interactions that you're having, and information that you might have as well in one place for the client. So you, your team, anybody you're working with has access to this information at their fingertips. You don't have to search through emails, handwritten notes, anything else. You just have it all at any point that you need it. Helps with the care, helps with your own workload, reduces your burden, administrative burden, stress levels for everybody involved.
Yes, we then have a planned renewal report, a task report. Now, a task report is typically a report of all of the different services or contacts that you have made with the client. You can filter this based on a certain client or a type of visit. So, as an agency, it's always good to have information, of how many phone calls did you make in the last 1 month, or how many home visits did your doulas do to different clients that you're working with. And all of that information can be obtained through our task report. So you have a good amount of information that you can export, you can filter, and you can always use if required. We also have a customer contact report, which basically brings together all of the contacts or customer contacts that are present in the system. Now, finally, the one report that we have, which I've seen a lot of agencies use, is the case management report, where you can run a report on a particular client for a certain period. And in this report, you will see all of the notes, the type of different services that you've provided, the time that you have spent with the client in a single report. And you can always edit these rates, right? So currently it's zero because it's a dummy account, but on your end, if you have a certain rate associated with a certain activity, that is something that will also show up right here. So you can always get this information from the system. Now, these are a few reports that are present on the FieldWorker system. And we then have the BI dashboard as well. So if I go into the BI dashboard, this is one of the reports, which is basically your demographic, right? It gives you an overall idea of your clients, your client's age, the different ethnicity, race, diagnosis. You can store this information on the system, how your agency grows, over a period of time, the way your agency grows, the number of clients or expected mothers that you serve can always be stored on the system and reported on. And it's again a good story to have visually.
Yeah, this is effectively giving you impact information, right? You're such a big contribution you're making in the lives of so many people. And what we are trying to encapsulate here with all the information that is centralized here is the massive impact that you're having, the positive impact you're having. And all these reports help you. You might be working for not-for-profit organizations, and some of these organizations require this information for their grant funding, for impact reporting, and we consolidate all that information in one place for you.
Yes. I'm now going to stop sharing my screen and we're going to share the AbilityHUB app.
So this is the second part of this. And again, I would just reiterate, if there are any questions that you have, anything, please feel free to ask them in the chat, and we are happy to engage with those. But the first part was for the case management organizations, for the Healthy Start organization who are working with expectant mothers. The caseworkers yourself are working directly with the mothers. The second part is the app, the AbilityHUB app, which is related integrated application that can be used by the expectant mother herself or her family member. So the app is there for building a circle of care around them to help with their day-to-day operations and their life. Key information can be shared between the two, from FieldWorker to AbilityHUB and vice versa, so you can stay in touch and in contact. The mothers can stay in touch and also help them lead a stronger, better, healthier pregnancy. So we're going to go through the app now.
Yes. So the AbilityHUB is an application that will typically be used by by the expected mothers, and it's a circle of care, right? It's every individual who needs to be aware of what the current status is can be a part of the AbilityHUB app. As an expected mother, you can request for services. You can display your medication. Every time you take medication in, you can store it, your current status, what you feel like. All of that information can be collected on the AbilityHUB app. You can even have new requests made. So if you go into the requests here, you will see that you can have errands, rides, meals, rest or break. All of this can be requested by the expected mother, and the same information is then available to the doula on the FieldWorker app. So it's more of an application that is used by the expecting mothers in order to give in their current status. Right? We have different tasks that can be set up. You can add multiple people. So if you want your emergency contacts, your significant other, your families to be a part of this, they can also have this and have the same AbilityHUB application and communicate with the patient right here. If you go out now, we also have the documents. So, you have a calendar, which basically has, any information, anything that is upcoming in the current days can be stored up on the calendar, will be present right here. You can even schedule tasks for the future. So in case there's something that needs to be done in the next few weeks, you can schedule it right here. And then finally, we have the documents tab where you can store documents, images, the forms, anything that was added in by the employee initially or by the parent can also be present here. And you can always take an image and store it on the FieldWorker system or the AbilityHUB system as well. So it's more of from the parent, from the user side or the client side, in order to make sure that it's a way of being connected between the employee, the mother, and making sure that you do not miss any information, right? We want to make sure that all the updates that are required are present and available whenever needed.
We are addressing typical communication breakdowns that happen, right? Information can be shared between the caseworker, the mother. The mother can track their journey. They can keep track of their medications. They can request help if they have built a circle of care, a circle of trust around them, of family members, significant others, aunts, uncles, friends. They can all have this app, and they need help with an errand, they need help with a doctor's visit, they need help with babysitting. They can request those right here in the app, can be accepted by someone, and everybody will be informed that they are not alone. Somebody is going to take care of them. This is basically, we're building the entire ecosystem around the expectant mother, for themselves, for their family circle of care, as well as from the point of view of the caseworker who is working with them. Everything from referral all the way to birth and postnatal infant health is covered. All the information underneath that is covered across the spectrum. That's the objective. We would love to hear your thoughts, your any questions that you might have. There is one question. Uh, can smaller organizations use this, or is it only for larger programs? Yes, we have many clients who are very small organizations who are using our program, and large organizations as well. So this doesn't require, our software doesn't require any hardware or platform on your end. Everything is on the cloud. All you need is a browser or a mobile phone, and everything is accessible for even very small organizations. Um, how customizable are the various forms and data fields for prenatal and postpartum care? Sunny, do you want to talk, just say about forms,
Yes.
how customizable they are?
Yes. I could talk about that, right? So, as I mentioned, right, every agency operates differently, and we at FieldWorker believe in customization. So, any form that you have can be created on the FieldWorker system itself. We have a few forms that are preset. For example, right here, these are a few forms that are created on our system. But as an employee, you can always go in and create your own forms, right? You can use from different modules such as text fields, area fields, all the way to date and time signatures that you can create, and it's a very simple drag and drop. So you can create a form in the exact format that you currently use to collect your information. You can do it on FieldWorker as well.
And how do mothers and families actually interact with Ability Hub day to day? So Ability Hub is an app. It's on the Apple App Store, as well as on the Android App Store. They can download it and start using it. They can use it individually as an expectant mother. But if you are an agency and your clients, who are the expectant mothers, are using the app, then they can be connected. Ability Hub and FieldWorker can be connected, and information can flow between them. But otherwise, Ability Hub is also a standalone independent app that can be used by the expectant mother and their circle of care, their family members directly as well. Um, can multiple people, like a partner or doula, be part of the same circle of care? Yes, that is correct. So as a care provider, as a doula, as a caseworker, as a care provider, you can also have AbilityHUB and you can become part of that circle of care, but you also have access to information from FieldWorker. So we've made it very easy to use with information sharing and having that circle of care being very tight from that perspective. And just to reiterate, we are completely HIPAA compliant, so information does not leave our ecosystem unless explicitly authorized by the owner of that information, which is you or the individual person who the expectant mother herself. Can we track things like risk factors, follow-ups, and outcomes over time? That's correct. So we have specific areas for goals, needs, where you can track all these things. Not only can you track them, as you meet, those things can be measured as well, as to how they are operating over time. So you can definitely track all those things. One of the key things is also that as you take case notes, right? And somebody asked about, early tracking of risk factors. As you are taking case notes, one of the key things is the information is consolidated in one place. The goals are consolidated, as you see, and you can see the progress of those goals as well. Needs are consolidated in one place, and your case notes are in one place. So as soon as you are in the system, you have a 360 view over your case. You have all the information available, and you can make very informed decisions about the next steps. And that is one of the key things that we are essentially um, eliminating the problem of information fragmentation, getting it all together in one place so that you have uh, the data to be able to make intelligent and informed decisions and effectively improve the outcomes for the mother. We are reaching the end of our time of our window. Actually, we've gone over by a couple of minutes. This webinar is recorded and will be available. We had a lot of people registered as well as a lot of people who attended. This webinar will be recorded. If you need any further information, please feel free to reach out to us. I am going to actually drop our email address in the chat and our website as well. And you can reach out to us. Our website is www.fieldworker.ai. Happy to answer any questions, engage, and hope you enjoyed the webinar. Thank you very much and have a great day.